Nonpartisan organization that works to empower people to choose how they live as they age. And we're founded on the simple premise that no one should have to live in a chicken coop. The shocking discovery of a distinguished retired teacher in Los Angeles living in poverty in a chicken coop is what inspired our founder, Dr. Ethel Percy Andrus, to organize AARP and devote the rest of her years to improving the quality of life for all as they age. At AARP, we believe that everyone needs a home, which is why we continue to advocate for housing that is accessible, affordable, safe, and secure. And that's why we're proud to sponsor Silicon Valley's Affordable Housing Month. During today's presentation, we will hear from Dr. Rodney Harrell on the AARP Livability Index, what it is, newly launched updates, and relevant research findings. Dr. Harrell leads AARP Public Policy Institute team of issue experts on long-term services, family caregiving, and livable communities. Dr. Harrell's research on housing preferences, neighborhood choice, and community livability are integral to the groundbreaking Livability Index, which measures the livability of every neighborhood and community in the United States. Without further ado, Dr. Rodney Harrell.
All right, thank you so much, Sophie, and thank you everyone who's joined us today. Excited to join you from all the way in Washington, D.C. into your living rooms to talk about housing AARP's Livability Index, something I'm very excited to be able to lead. First and foremost, let me share these slides here. Get this going for folks. And I want to share just some contact information you see on the slide. For those of you that are on Twitter, I'm very active there. You can always find our information at that website at the bottom, aarp.org/PPI for Public Policy Institute. I'll share some more resources later. But what I want to do is I want to give you some setup first before I jump into the Livability Index as a whole. And I'd like to start where actually Sophie started, that AARP did begin. The idea for it began when our founder found one of her colleagues living in a chicken coop. 2 decades later, she actually went to the White House with a model of a home that was called the House of Freedom. And in recent years, we've been working on our livable communities efforts, which I'll get into more later. But the idea that from problem to early on concepts to actually figure out ways how we can implement, how we can help communities to become more livable and have the options that all people need. That's really been the work of AARP over time. And I like to start off every conversation with this chart about why things are so important. So first, if you look on the right-hand side of your screen there, you'll see a Census Bureau graphic here. The orange line are the percentage of people who are under 18, and the blue line are the percentage of people that are 65 and older. And what it shows is that by 2034, we're going to have more people over the age of 65 and under 18. Now, what's fundamental about this is that it's the first time in US history that that's happening. So that means from the 1600s until today, there's been more younger folks in communities than older adults. And that's meant that we can have a range of shortcuts. We can build homes, communities, design things for people who are younger and get away with it. But though that demographic shift has been happening and is happening, and the idea that we now must pay attention to the fact that we've got people of all ages in our communities, it's becoming an imperative for communities and others to understand this. And so in my 14 years with AARP, I'll say it's become much easier, frankly, to talk to community leaders who have now today understand that they have an issue and something they need to address. Whereas when I first came to AARP, it was telling people that there are people aging in your community. You need to be aware of this. There's a lot more education about the fact that people were aging, but now we can move more towards solutions, which makes me more excited because that's the heart of our work. Now, on the left-hand side are a couple of just thoughts here. One is that we survey folks all the time, and we often find that the vast majority of older adults want to age in their homes and communities. Nearly 8 out of 10 of those 50 and older, and over 9 out of 10 of those 65 and older want to stay in their homes or communities as long as they can. And I mentioned about how demographic change is really making this important, not to mention the fact that this large number of older adults means that we have a very diverse older adult population, people of different racial groups and income levels and different locations. So we really have to think about all of that as we're thinking about community planning, design, other issues, and really the need to transform our housing. We can no longer take shortcuts to get there. So let's start with some of the challenges that really push us here. First and foremost in our minds for most things is the impact of the coronavirus. And my team creates the nursing home dashboard for AARP. And as the crisis went on, we looked at how many deaths were happening across the country in nursing homes amongst residents and staff. And I won't get into the numbers here, which are shocking, but just the idea that there were these deaths happening really helped to spark a rethinking amongst many families. If you think of the hundreds of thousands of people who passed in nursing homes, well, each of those persons had a family. And as those of us that work in the long-term care space know, whenever you do survey residents about things that prevent them from leaving the nursing home, housing is at the top of that list. So we need housing choices so that people can stay in their neighborhoods as they want to, as we just talked about. And unfortunately, in this pandemic, those that were in nursing homes that didn't need to be really faced the brunt of that. So it's really brought urgency to this conversation. People who don't want their mother or father in a nursing home and are thinking about housing options. So that's really kind of spurred that. Other than that, the pandemic has really spurred some of these socioeconomic challenges that already exist. We, especially in California, you're well aware that we've had a long-term affordable housing shortage and across the country as well. There's really, housing is expensive and there's not enough choice. So that's been the case, but particularly in certain areas near the kinds of things that people want to be near, and also for certain groups. So we know that certain groups, African Americans, that's like Hispanic Latino families, especially have ended up with more limited housing choice for a range of reasons that we can get into in the Q&A if you'd like. But COVID has hit more in certain communities, and things like the job loss and other economic impacts associated with COVID has made that even worse in different communities. So all in all, even though COVID has brought great attention to some of these housing inequities and housing issues that we have, it's proven that we can't just have short-term solutions. So it's bringing attention, it's making these things stronger, but we need some solutions that work. And then generally this idea that we aren't necessarily building communities with a livability mindset. This is an example of one community where you have to walk very far to get the things that you need, but just that idea of bringing people to things that they need. Now, AARP defines a livable community as a place where people have the housing and mobility options and other community features that people need to be able to thrive in their communities. Things like homes with zero-step entrances or access to parks and libraries, or communities that have walkable elements to give you an option of whether you want to walk or take a bus or drive to get the things you need. And the challenge is that people of all ages need access to these communities. People with various income levels need access to these communities, and people of various ability levels, levels of physical ability, they need access to these communities, and it's just not there. And that is something that we work hard and thrive to achieve. And so, if we go to this next slide here, this all comes down and is impacted by this conceptual framework here. And this is the idea of how people end up in the neighborhoods they're in. And so we all have our preferences for neighborhoods. We may want a place that's near many of those things I just mentioned. We want a place in our price range. We want a place that's near our family, perhaps. We have a range of preferences. One of the things that's fundamental to our work is that those preferences might change over time. So you may not think about a home with transportation options because you're young and driving all the time. You say, I'm fine driving everywhere, my car works well. But what happens if you can no longer afford, your car breaks down, you can't afford to repair it? What happens if your eyesight falters and you're no longer able to drive. Now, all of a sudden, having transportation options nearby is crucially important to you. So the idea of a real livable community is one that provides those options that will serve you today and tomorrow, especially giving you the options if your conditions were to change. Now, some of these things that are limited in communities, there are limitations to limit your neighborhood choice, are things like your family budget, the fact that you just don't have enough income to afford some option that you'd otherwise want. That can be an issue. Additionally, the idea that there just aren't the types of neighborhoods that you want nearby, or you may not know that those neighborhoods are there. So there may be something across town or across country that may meet your needs and you don't know about it. And then, of course, there's the actual or perceived or actual discrimination that if you don't feel welcome in your community for some reason, whether you are welcome or not, that limits your choice as well. And the idea is that all of those kinds of limitations prevent you from achieving your preferences. And so if you take your preferences and then account for your limitations, we end up with your home and community location. And a lot of the work that we do, that public policy can do, that changes in the industry can do, are really to reduce those limitations, to provide more options so that you have a better chance of achieving your preferences in your home location, no matter who you are. So that conceptual framework really is important and fundamental. This comes from my previous research, my dissertation work, but it's really fundamental to the idea of how we can change communities and make them work for people. And so in short, every housing choice requires a trade-off. There are no perfect communities. The idea that a community that has all the features you want at the price point you want and the exact location you want, it's just hard to find. And we know that there are trade-offs between those communities. And what's really helpful to folks would be the idea that, well, maybe we can figure out a way to help you have more information about communities. Maybe we can figure out ways to help improve the choices that are be able to make. Maybe we can improve the livability of communities. So that's something that societally I think would be good to have. So keep that in mind as we continue the conversation here. And that takes us to the formal definition of a livable community for AARP, which I have listed here. And you can see what we actually mean when we define and say a livable community here. Again, safety, the options for housing and transportation, and the other community features and services that help people stay in their communities, be independent, and engage in their communities. That's our official definition, and it really drives our livable community work. All right, so those are the problems, kind of the setup here, but let's get to my favorite part, the solutions part. And to me, solutions come in there's a three-legged stool to really get to how we can talk about and think about solutions. One is policy work. The work to actually change policies on the ground that expand options for people of all ages, all income levels, all ability levels. In California, we've got legislation that's made it easier to build accessory dwelling units, which I'll touch on again later, or make it more easy to find homes that have universal design features that make homes easier to use for all folks. Those things came through legislation, and that's one way that policy can impact us. But there's also an industry shift that policy can make it easier to build things. The lack of policy or the wrong policy can make it harder to build certain things. But we actually need the industry folks to build it, to create the products we need, to create the homes with those zero-step entrances, for example. Those need to be built. And so influencing industry is important. And then finally, people. That even when products are there and existing, if we are not looking for it, if we are not asking for it, if we're not demanding it, then A, it's not useful for us as individuals, but B, if there's then a lack of motivation for industry to create it and a lack of motivation for policymakers to make the policies that can help make it easier for those things. So really, there's these three legs of the stool that kind of all have to be addressed if we're to create better choice. So I want you to think about those three legs as when we talk about the work that AARP does. And now to the heart of what I wanted to talk to you about today, our AARP Livability Index. Now, this index was relaunched just 2 weeks ago, and it's available at aarp.org/livability index. And those of you who are online can go ahead and look at your index scores if you've got another screen or another device. AARP.org/livability index. And if you've used it before, we completely rethought the design and interface of our index. And I'll talk a little bit more about that as we go here. But the idea is that we created this index at first in 2015 as the world's first neighborhood-based nationwide livability index. And as you've heard me talk for the first 15 minutes or so, you see the reasons why we thought about creating something like this. We need something that can help us define what a livable community is. We need something to help us share information with people about what livable communities are, how livable one place is versus another. Something that helps us promote policy, that helps us influence industry, help us educate and inform individuals. And so all of those things were needs that we work to address with our livability index. On the right-hand side, you'll see 7 categories: housing, neighborhood, transportation, environment, health, opportunity, and engagement. The idea is that people need a place to live. They need to be things that are nearby. They need to be able to get around. They need a clean environment to live in. They need access to healthcare. They need economic and other forms of opportunity. And they need social and other forms of engagement with their neighbors, right? So these are 7 categories of things that we could measure. And so we developed this set of attributes. Within the index, there are now 40 metrics and 21 policies across all of them. And so, for example, under housing accessibility, we'll have under housing, we'll have housing accessibility, whether there are those 0-step entrances. Housing options, are there options other than a single family home in your neighborhood? Housing affordability, what are the housing costs? What's the housing cost burden? Is there subsidized housing in that neighborhood? And if there aren't those things in place, are there policies that can help bring those things about? Is there a housing trust fund? Are there policies to support people and protect them from foreclosures and preventions? Does a state have a policy in place that makes it easier to build accessory dwelling units? That's one of the new policies, or that's the major new policy that we've added since we created the index. And it goes on similarly across all of these other categories. If you've logged on to the website and looked at your score now, you'll see it in any of these other areas. And I'll just, in the interest of time, I'll just look at transportation, and we can talk about any of these other categories during Q&A. But the idea is that we're not just going to look at housing and housing cost, but we're going to look at these 6 other categories. And in transportation, we're going to look at whether there's convenient transportation options nearby, whether there's transit, whether what the traffic volume is. We'll look at the average cost of transportation, how safe those streets are, how fast speed limits are on the streets. So if I get hit by a car, it's more dangerous to me to be hit at high speeds. Are the trains and buses designed to meet people with ADA needs, people with accessibility challenges? Those are all things I might want to know about a neighborhood once I know how affordable that neighborhood is, how many housing options are in that neighborhood. And in that way, all of these pieces of the index are intertwined. And so the idea is that we give you a score in the index that takes into account all 7 of these areas. I'll give you just a sneak peek of that on this next slide. And this is a community in New Jersey in this one that we looked up. But the idea here is that this community gets a 55 overall. We've looked it up on the AARP.org/livability index. We'll look at this thing and we'll see the score that's here. And just a little bit of demographic information there. And underneath this, we'll have the metrics that I mentioned across each of those categories. And each of those categories has its own score. The idea being that all of those things are important, and we can combine those scores into one score for you to look at overall. Additionally, we give you the ability to weight your score so that, for example, if you look at our neighborhood category and the importance of having things nearby, while we think it's important, if it's not important for you, you can lower the weight of that category. And then you can readjust, it'll automatically readjust a score of a certain community to match your own personal preferences. Getting back to that point about preferences changing. across individuals. And then you also have the ability to compare communities at the bottom of this page as well. The idea that you may want to, if you're home buying, you may want to look at one side of town and a neighborhood somewhere else. If you're a community leader, you may want to look at what the people in the east side of town have access to versus the folks on the west side of town. And so we wanted to make it clear and easy for people to compare communities. And it's been a very powerful tool for us over the years. And right now I'm giving you that sneak peek of that new design that we unveiled last week on the Livability Index. And again, we measure every neighborhood across the country, to over 211,000 neighborhoods across the country get a Livability Index score here. And not only is the index useful for those purposes I mentioned, it's also incredibly useful for research purposes. So I want to talk a little bit, spend a little bit of time talking about a study that we did with the Harvard Joint Center. This was using data from our the last version of the Livability Index, but some of the data findings I think are really important to the conversation that you all are having in Silicon Valley. First, the key findings here were that most older adults don't reside in livable communities. When you look at the scores in the index, we found that the vast majority of older adults were just not in communities that were scoring high, which meant that they were making a lot of compromises in their housing decisions. So that if you wanted to stay where you were, you had to make a lot of trade-offs to just maintain that 80% of folks that want to stay in their homes and communities were making those trade-offs. That livable communities were not livable for the same reasons. So what was a really interesting finding was that those top scoring communities in the Livability Index aren't necessarily all the places you might think of, especially when you look at the neighborhood level, again, because of those trade-offs we mentioned. So that places that have great parks and libraries and people get together and have high voting rates and good schools, they might be very expensive. Where the place that's less expensive might have slightly worse schools, but has great transportation options. They might have clean water and air and other things. So just the idea that these neighborhood by neighborhood, people were making those trade-offs as we described earlier. And the older adults' access to livable communities is not evenly distributed, that different parts of the country have different types of neighborhoods. And that goes to not only the legal framework that's in place that causes to create communities, other geographical differences, just income differences in the populations of areas. So where you live pretty much determines how much choice you have. And that choice varies greatly. That's another finding from that study. 3 more things. Number 4, there's a relationship between the different types of livable neighborhoods and income, race, and home ownership status. The idea that people of different racial groups or income groups are in different types of communities. So even if you're in a highly livable space and you're a person of color, you may end up more likely be in a neighborhood that has things nearby and transportation options and the like. But if you're a white American and are in a highly livable neighborhood, you're more likely to be in a place that has some of those community features we meant, or high social engagement. So people are, again, in different neighborhoods. And similarly, home ownership status made a difference. Our renters are typically in neighborhoods that have higher livability. And that is probably because of the flexibility that renting gives you. You're not as tied to your community, which may have some negatives, but one of the upside can be that you have more flexibility to be in a location that's near the kinds of things you might need. So that was another one as well. Lots of interesting things about what's there. And interestingly, older adults who tend to tend to relocate in places that are similar to the places that they left. So this really gets to my point about information and the information gaps that are there. The idea that people may not be clear on the trade-offs that they're making, because many people end up in similar neighborhoods and aren't necessarily making decisions that give them more options as they're aging. And this becomes important because I have seen myself and heard from many people whose dream turned into a nightmare. The idea that they were in some sort of suburban neighborhood that was a nice cul-de-sac, it was quiet, was a great place to raise our kids. Well, then their spouse dies. They no longer drive, and now they're isolated and can't get around, can't get to the things they need. And those things happen. And those are the kind of decisions I like to help inform with our work that we do here. And just some quick graphics to show a couple of those things. I mentioned this earlier, that the non-Hispanic white folks are blue on this table. And you can see that where they are mostly in neighborhoods that score high on engagement and opportunity, these two bars on the left here. And they're much lower in percentage in neighborhoods that are score high on housing, which would be housing costs, housing options, transportation costs and options, neighborhood options, things nearby. Whereas you can see the opposite for African Americans, they're a higher percentage in those neighborhoods, as I was mentioning earlier. So again, people are in different types of neighborhoods when you look closely at the population. Another thing I wanted to point out was that the cost burden is incredibly high. So the housing industry considers people who pay at least 30% of their income as housing cost burden. And the idea is that you are unable to pay for other important things if you're paying more and more of your income on housing. Your health emergencies, transportation, other things just become more challenging. And so what this graphic shows is the highest livability areas are orange and the lowest livability areas are blue. So that's how these colors work. But let's just look at the folks that are in orange here, they're in the high livability areas. So the younger group, you'll see between 25 and 30% have a housing cost burden. But by the time you get to the 65 to 75 group, that's well above 30%. And by the time you get to the 80 and over group, it's nearly 40%. So again, the idea that if you're trying to get in places that have these options, you're going to pay more. And that's even more of an issue as we're aging. So something else that I want us to all be aware of. And so what do we do with this information? One thing I'm very excited about is that for about a year now, we've been working with the National Association of Realtors. And what we've done with them is we brought the Livability Index into what's called their Realtor Property Resource. It's the website that a realtor would use to give you a printout of your features of your home when you're looking at a home. And amongst the information that they give you about the neighborhood and location, they'll give you that livability index scores and the 7 category scores for each of those categories I mentioned. And the idea that we're helping to educate you, helping to at least give you that information in your hands about the kind of choices you're making. And it's incredibly helpful as we've gotten really helping people understand those options better. And frankly, I mentioned the index also counts the public policies that are there, also kind of bringing that information to folks as well and helping to support the kinds of policies that people need to expand choices. So I'm extremely excited about that relationship. One other relationship I'll mention quickly is our relationship with Lowe's. Now, we know that many people do want to stay in those homes. And so we have a relationship with Lowe's to look at how we can help people stay in their homes. And so it's called Lowe's Livable Home, and it's at lowes.com/livable home if you want to look at this. But you'll see videos and articles and other resources that we're using to help reach Lowe's customers where they are and help them understand these kinds of things wherever they decide to make their housing decisions, but how they can do the kinds of things that can make their homes better for them, to adapt those homes, because we just can't have enough homes currently that will have the universal design and other features that really help people stay there. And finally, I just want to mention our accessible dwelling unit resources. And California has been a leader in the country on making accessory dwelling units an option for folks. These are the in-law units, the guest suites, whatever you'd like to call them, guest homes. But what we've done is we've looked at some of the successes in California and Oregon and in Vancouver and other places, and we've developed an ADU design and development guide that tells you about some of the regulations that are there, some of the finance options, how you can go about this if your own home, along with some of these sample designs that are in that guide. We also have an ABCs of ADUs that really tells you about what accessory dwelling units are, our home fit guide, which tells you about making those changes in the home, as I mentioned earlier, and a book on making room, which was an exhibition that the National Building Museum had that really talked about, as an aging America, what do we need to do and change? And it's really are really an interesting look as well. We've got a lot of things at the website up on the screen here that you can find. And don't worry about these links, I'll share them all with you in a second. But I just want to give you a little flavor of the kinds of things that we're providing. And the idea is that in total, what AARP does in this space is we see ourselves as everyday innovators in aging. It's the idea that we're trying to look at some of the issues out there, look at what's happening, and then develop some of the tools and resources and share them to help try to create change in communities. I'm very proud of not only the work we've done nationally to provide these resources, the great work that the team out in AARP California, Sophie, Shea, and others have been able to do to help support some of the policies and programs that can create more housing choice and other kinds of choice. But I think all of you can be everyday innovators as well in how you shape your own housing choices, how you talk to your friends and neighbors, the community groups that can be formed to help implement the kinds of changes needed. And so my goal is that we can provide some of those resources to all of you that you can become everyday innovators in aging yourselves. So with that, I want to thank you for your time. I think we've got a few minutes for perhaps some questions or comments. I haven't been able to look at the chat while I've been talking, but I will leave this slide up for a minute so that you can see all the links that I mentioned today. And again, I just want to thank you very much for having me.
Thank you so much, Rodney. I am curious on the index. What is like a good score? I realize there are a lot of different factors, but is this the score of 57 over the scale of 100 or 70? Is that how we're looking at it?
That's a great question. Great question. So the way it works, and for those of you that have the index up, you can see this, is that the score is from 0 to 100. And the idea is that if your neighborhood or your average neighborhood in your city, if you're looking at citywide, but if your neighborhood has, let's look at the housing example. If you've got the greatest amount of housing choice, everything's got universal design, housing super affordable, then you might get close to 100 in that category. But you've got the trade-offs of the other categories. So if housing super affordable, you may not have great parks or libraries or something else in another category. So long story short is that the US average, the average community has a 50 in each category and a 50 overall. That's how we split this out. And so if you're in the top half, you're doing well. But as you're hinting at, Sophie, there aren't that many places that get higher than 60s overall, right? So the idea that, to my point about the trade-offs, there are trade-offs inherent in every community. And so the idea is that every community can improve. So we'll let you know if you're in the top half or how you are on that scale. But if this is a test, most of us are not doing very well on that test in terms of our communities meeting all of our needs. So whether you're in a high income, high cost suburb, which has its challenges there, or whether you're in an inner city neighborhood that's facing disinvestment issues, you've got your challenges there. They may differ, but the idea is every place faces some kind of challenge. And every place can improve.
Thank you.
All right. So let's see, I guess we've got some things in the chat here, if I can answer some of these things. Let's see, speak more to where the Livability Index data is coming from. So one of these, so the Livability Index gets data from about 20 different sources, including many federal sources like the American Community Survey and the like. And there's a full list of the sources in the index itself. So what we tried to do is we actually started with over 300 different potential sources, and we narrowed it down to the ones we have in it. And I said 20, I meant to say 50. I meant to say 50 different sources are in the actual index now. And we basically picked the sources that would allow us to create this measuring stick nationwide. And so the idea is you may very well have better information locally than we have, but what we really wanted to do was to create this even measuring stick that could be used anywhere in the country. So we eliminated some measures that we couldn't get for the entire country. To pick one, we don't have any measure of sidewalks because there is no national sidewalk measure, but you very well might have great measure of the sidewalks in your community, and that may make it easier to walk around in that community. But what we do have are the 40 metrics and 21 policies that we do track to make sure that your communities work for you. So that's very important to us. All right, let's see. I see a question here that says, how does a person actually determine if there's a race ethnicity limitation using the index? So I can't share my index screen very easily right now, but if you are looking at the Livability Index and you click on the map, what we've given folks the ability to do is to click on the map, and you could look at any of the factors in the index. You can look at the housing or the environment overall, or you can look specifically at different indicators. And then you can look at different demographic information. You can look at where older adults are living, or where people of color are living, and other factors. And so in many cases, you can see some clear and stark differences. In my community, home community of Washington, D.C., you can very easily see that most of the African Americans live on the eastern half of the region. And in the southeastern part of D.C., there's very few grocery stores, for example. And so that speaks to some of the challenges that are facing particular groups in this city. And it's similar. There's similar challenges in other communities across the country too. We allow you to see that, but I want to note something very specifically, that when you're building a tool like this, I also don't want to be used as a tool to promote discrimination either. So while the information's there and you can find it, it isn't presented in a way that says that certain communities are bad or less valuable than other communities. Again, every community has something to work on, and we want to set this up so you can see those trade-offs, see those issues, see what's going on in each part of a community. Okay. And Lori, thank you for your compliment. Fran has a question about what's the future of over 55 communities. That's a great question. And one of the things that you haven't heard me talk about a lot today is 55 plus communities. And one of the factors in our livability index is actually how multi-generational a neighborhood is. So will a neighborhood that has a mix of older and younger people, basically closer to the US average, that community will get a higher score than a place that doesn't. Basically, if you've got many more older adults than that, the idea is that many of those communities, and we're still talking about cities here, have places of challenges that younger people have left for a reason. And if you've got a neighborhood with younger folks where there are no older adults, oftentimes there are barriers to prevent older adults from living there. And so when we think about livable communities, we think about that generational exchange of information and just all the things that can come from bringing people of different ages together. Now, all that said, there's still a percentage of folks who want a 55 plus community. And I think that will always be there. So for those who can afford it and want to choose that, that's certainly an option that's on the table, and one that should be there for folks who want that. One of the challenges that many of those communities find, though, is that over time, especially as we're living longer, you end up with multiple generations of folks in a 55 plus community. And so you may start off as an active adult community and then find yourself with people in their 50s, 60s, 70s, 80s, 90s, and beyond. And so again, you have to think about being multi-generational even within a 55 plus community. And sometimes the community operators aren't thinking that way. And so they don't have, I've seen 55 plus communities that didn't even have some of the options that people needed nearby. So if you're building one of these communities, you need to have the kinds of things that people need, again, those range of options, and it's, people are paying to get in, so you need to create that. And where our work, though, focuses on is the rest of the community, the wider community, where the public policies and other work is shaping the communities. We want to make sure that we have the ways to help improve those community options are available to everyone as well. So, there's definitely a future for 55 plus communities. There are some challenges in that space, but the vast majority of folks will continue to live in the general community. All right, Barbara asked about renters who are seeking a livable and affordable community. Now, I will say, Barbara, that the Livability Index is meant to help people, whether they're renting or owning homes. The idea that if you're looking for things in a different location, it's a great tool to look at amongst the other tools that you're looking at for locations. So, what is this? What of all the neighborhoods I'm looking at, which ones have the most options for things that are good? We do the community itself, not a particular type of house and not a particular type of person, but we look at each community. And so that's why it's, I think, a great location tool. And so I'd encourage you to use that. I think there's also some great policy resources on so many of the challenges that are facing us to having affordable housing all over. But what I would personally recommend is somebody who is looking to rent would be to find kind of the local, whether it's in DC, we have, I think it's rent.com, some other resources online, whatever resource you may want to use, whether it's some Realtor resource or what have you, to understand what the prices are for different types of places you'd want to go. Look at what the features are in that potential property. Then use tools like the Livability Index and others to understand what's around that place and what's in that community. So the long story short is take into account all of the parts of a neighborhood and home that you might interact with or need, and then think about how your needs might change during the time you're living there. And if you think about those things, if you think holistically about your needs today and tomorrow, that's the way to make that best housing choice. So with that, I think we've got to all the questions I see in the chat here. And Fran and Carlos, thank you for your kind words as well. And I really hope this was interesting for you all. I hope you enjoyed our little time together.
Thank you so much, Rodney. Just to let you know, we have recorded today's program and it will be up on the AARP YouTube site and will be shared so that you can share this with others or decide to review the program again. Again, thank you so much for being with us. Thank you so much, Rodney, for your presentation today.